How to have anterolateral approach to the humerus. A patient marked and consented under aseptic conditions, position supine over the arm board, a humerus shift, marking is done. The interval will be at the proximal point. It will be between the deltoid and pectoralis major. Deltoid supplied by axillary nerve, pectoralis major by medial lateral pectoral nerve, middle interval between bicep and brachialis. Distally, the plane will be from with brachialis and bicep retracted medially and mobile wide brachioradialis retracted laterally. Mobile wad brachioradialis ECRL and ECRB. The deep approach will be brachialis muscle splitting. Medial part is musculocutaneous nerve and lateral part is radial nerve. Incision marking from the tip of the coracoid distally in line with deltopectoral groove along the lateral aspect of humerus and more lateral along the anterior border of deltoid. The risk is anterior circumflex humeral artery, lateral cutaneous nerve of the forearm, which is terminal branch of the musculocutaneous nerve, and radial nerve, which is in brachialis and brachioradialis interval. Plate should be placed medial to the nerve.